progesterone and produce testosterone as androgens, and this testosterone or androgens goes to the granulocyte cells, and granulocyte cells can produce estrogen from these androgens. It means that the TECA cells produce progesterone, granulocyte cells produce both progesterone and estrogen. I want you to remember it. TECA cells produce progesterone and granulocyte cells produce progesterone and also estrogen. Why? Because granulocyte cells has aromatase enzyme. So Sertoli cells and granulocyte cells, both of them has aromatase enzyme. Yes, maybe in the final exam I ask you which type of cells contain or has no aromatase enzymes. You should know Sertoli and granulocyte cells. We have a aromatase enzyme in these two types of gonadal cells. Okay? Okay, let's talk a little about estrogen and progesterone. My dear friend, estrogen is a general reference to some types of hormones. This is 7-beta-estradiol. We always abbreviate it as estradiol. We always said as estradiol, abbreviated as E2. 7-beta-estradiol. Sometimes I refer to estrogen or like estradiol. Estrone and estradiol, all of them is a general term, is a term for estrogen hormone. Estradiol is high during not pregnancy period, but estrone and estradiol during pregnancy and breastfeeding period. Some organs such as adrenal and placenta can produce estrogen, my dear friend, and generally we can say that estrogens, beta-estradiol is more powerful rather than other estrone and estradiol, and like other steroids, estradiol should bind to some molecule and some protein such as albumin and gonadal steroid binding globulin, GBG, to circulate in the blood. So steroidal hormone should bind to some proteins to circulate in the blood. Here, estradiol should bind to albumin and gonadal steroid binding globulin. Albumin is the most abundant protein in the blood. If you remember, albumin is responsible for osmotic pressure of the blood, and it's abundant in the blood, so estradiol easily bind to albumin and circulate in the blood. What happens if there is a high amount of estrogen in the female? Hyperesternis. What happens? Early puberty. Yes, infertility, because we know estrogen has a negative feedback on HPG axis. So if some organs, such as adrenal, produce high amount of estrogen, has a negative feedback on HPG axis, and it's the cause of infertility, yes? Yeah. And also postmenopausal bleeding may be happen if there is a high amount of estrogen. In male, also, in some cases, we have a high amount of estrogen. And yes, enlargement of breast. Such as, imagine that if there is a overactivation of aromatase enzyme in male. In male, what happened by overactivation of aromatase enzyme? The testosterone produced to estrogen, and the amount of estrogen may be increased, and maybe we have seen some phenotype of females such as breast growth or testicular atrophy.
In the male Israel,
Yes.
it is not very common in the male, but in the is coming. Because the estrogen
Yes,
is not.
yes. Yes, we can say that. So, my dear friend, if you want to remember the function of estrogen, always remember that estrogen is a proliferative hormone. Is a proliferative hormone. Proliferation. As a proliferation. Proliferation is increase the size and increase the amount of cells. It means increase the size of ovary, size of breast, size of endometrium, increase the size, proliferatory hormone. Estrogen is a proliferatory hormone. That's why I told you that during using estrogen as a contraceptive, maybe chance of cancer increase in the body because it's a proliferatory hormone. Estrogen decrease FSH secretion, as you know. Estrogen increase the secretion of some another proteins such as angiotensinogen and thyroid binding globulin. Estrogen increase blood flow of the uterine, increase muscles and its contraction of the uterine. So during pregnancy, this hormone is important for the final stage of pregnancy, that is a labor. During labor, estrogen is going to be high. So, my dear friend, we have a phase that we discussed. It's a menopause. Menopause means menstrual cycle, pause, stop. Menstrual cycle, stop. This stage is happen after age 40 or 50 in female, and estrogen deficiency causes osteoporosis. Why? Because, my dear friend, reduced estrogen increased osteoclastic activity, decreased bone matrix, decreased deposition of calcium and phosphate ion, and by all of these, osteoporosis has a high prevalence among female after menopause stage. By menopause, because estrogen decrease, osteoporosis chance increase. Any question? Progesterone is another important hormone, my dear friend, secreted by corpus luteum, by placenta, and also progesterone should bind to another protein such as albumin or corticosteroid binding globulin to circulate in the blood. One interesting thing is that progesterone inhibits estrogen's function. But on the other hand, estrogen activates progesterone's function. There are in different ways. One of them helping to act to promote another one, but progesterone inhibits estrogens. And by the way, in the contraceptive tablets, we are using low concentration of estrogen and low concentration of progesterone. Both of them are in the tablets for contraception in female because estrogen increase the function of the progesterone. Generally, my dear friend, progesterone can be categorized as a secretory hormone. As a secretory hormone, if you want to remember always the progesterone, remember it as a secretory hormone. Caused to swell and enlarge and absorb water in any organs. And in the history of contraception, at first they used estrogen. Estrogen caused cancer. They stopped using estrogen and then choose progesterone. But what happens if we use progesterone as a contraception? Swelling and the absorbing water increase in the body, and finally what happened? The chance of heart failure increase. The heart failure increase among women who use progesterone as a contraception. So, after some experiments, they are using low dose of estrogen and low dose of progesterone for contraception and inhibition of HPG axis. You are seeing that there is a very painful history for development of any drugs. Many women died by this use of estrogen and progesterone, and we are now only talking about this history, but there is a very high mortality history for development of any drugs that we are using nowadays, my dear friend. So until here, we have we found the ovarian cycle, but in the female we have endometrium. So we have another cycle which is in parallel with ovarian cycle, named endometrial cycle. Endometrial cycle, the cycle which happens in the endometrium. Do you know the meaning of all of these organs? In anatomy, okay. So, as you are seeing, endometrium has 3 stages. I want you that you tell me what is the proliferative phase, timing is equal to the which phase of ovarian cycle? Proliferative phase of endometrium. Endometrium start to grow. First, what is the first phase? Follicle stimulate, follicular phase. Yes, follicular phase is somehow equal to proliferative phase of endometrium. The second phase, secretory phase, is yes, in parallel with a luteal phase, that progesterone starts to absorb water and become secretory the endometrium. And menstruation, my dear friend, is the end of secretory phase when the estrogen and progesterone start to drop. In the case of no pregnancy, if there is no pregnancy, the estrogen and progesterone, if you remember, from here, if there is no pregnancy, the estrogen and progesterone start to drop, corpus luteum convert into corpus albicans, and menstruation is happen. Menstruation is happening here at the end of a secretory phase. So menstruation is bleeding of endometrium. It varies between any species, between any different people, but approximately 40 milliliter of blood and 35 milliliter of serum are going to out of the endometrium. And there is the leukoura, increased amount of the leukocytes in the endometrium to inhibit any kind of infection, because endometrium is bleeding in this situation. So there is a high amount of leukocytes and white disease against any kind of infection in the endometrium. My dear friend, this is proliferative phase. This is secretory phase. They become swell and enlarge. And finally, if there is no pregnancy, the corpus luteum convert into corpus albicans, so there is no estrogen and progesterone, and endometrium destroyed. The whole tissue that produced during proliferative and secretory phase destroyed.
So I mean the changing that happened in the uterus?
Yes.
To become ready to stop the pregnancy?
If there is a pregnancy, they stay in the secretory phase,
Yes.
okay? The corpus luteum stay and produce the same amount of estrogen and progesterone, and this secretory phase stay. We discussed about puberty and menarche, my dear friend. This is puberty. Here, imagine this girl is reaching to puberty. Puberty, it means increased amount of estrogen hormone. But after some years, the cycle of ovary reach to a level to produce oocyte, to ovulation. So after some years, we need time to ovulate any oocyte from the ovary. We discussed about menopause, my dear friend. Menopause, it means that the ovaries are burning out. There is no estrogen in the ovaries. So, can you tell me what happened in the menopause? Please pay attention to me. What happened to the LH and FSH in the menopause? Disappear. Why? LH and FSH are produced by pituitary.
Negative receptor. Diğerlerini bekliyor.
Do you think during menopause, LH and FSH increase or decrease?
Decrease.
Why decrease? We know that estrogen has a negative feedback on LH and FSH. If there is no estrogen, the LH and FSH must be increased. Yes? Imagine that there is an inhibitory effect of estrogen on the pituitary remove. LH and FSH increase. Yes? Is it logic to you? No. The pregnancy related to estrogen which produced by the ovaries. But we are talking about FSH and LH. Here you are seeing that the red line, my dear friend. During menopause, LH and FSH increase for near to 5 to 7 years. But after 5 or 7 years, again, we can see the reduction of LH and FSH. So, let's only introduce you, my dear friend, the hormones during pregnancy. We have 4 important hormones for pregnancy. Estrogen and progesterone, you are familiar with them. We have another hormone named human chorionic gonadotropin, abbreviated as HCG, human chorionic gonadotropin. HCG increase in the first month of pregnancy, and for checking the pregnancy by the blood or by the urine, we are checking HCG type, the type of beta. Beta HCG has 2 parts, alpha and beta. We are checking beta HCG in the blood or urine for checking the pregnancy. The HCG increase in the first and second month of pregnancy. The 4th hormone, the last hormone which related to pregnancy, is human chorionic somatomamotropin, HCS, human chorionic somatomamotropin. These are 4 hormones that is important during pregnancy. What is the function of HCG, my dear friend? The primary action of HCG is to stimulate LH receptors on the corpus luteum and prevent involution of corpus luteum, prevent menstruation. And what is the main function of HCS, or human chorionic gonadotropin? In fact, there is no exact belief about their exact function, but we can say that this hormone acting like a growth hormone This hormone acting HCS is acting like a growth hormone and mimic like some decrease insulin sensitivity of mother. Decrease insulin sensitivity of mother. What does it mean? If the insulin sensitivity of mother decrease, the mother can cannot use glucose in the blood, yes? Insulin are sending glucose into the cells. You remember? Insulin sending glucose into the cells, and if the insulin sensitivity decrease, it means that the body cannot send glucose into the cells. The glucose stay in the blood, and glucose are passing through the placenta into the fetus. So fetus are using glucose. This is the another possible function of HCS during the pregnancy. Any question? No? Okay, let's have a quiz.